If menopause brought changes to your intimate comfort that nobody warned you about and you've been quietly managing them alone, this video is the conversation your doctor should have had with you a long time ago. Okay, let me start with something that I hear in almost every consultation about this topic. Women come in and say the same thing in different words. I thought I was just part of getting older, or I assumed there was nothing I could do, or simply I didn't know I could ask a doctor about this. Vaginal dryness and the cluster of changes that come with it during and after menopause are among the most common experiences women go through. Studies suggest that up to half of all women experience significant vaginal dryness after menopause. Some estimates put it even higher. And yet, it remains one of the least discussed aspects of menopause in both healthcare settings and everyday conversations. And yet, it remains one of the least discussed aspects of menopause in both healthcare settings and everyday conversation. Hot flashes get talked about, mood changes get talked about, sleep disruption gets talked about. The changes happening in vaginal tissue get quietly managed alone for years. I want to change that in this video because understanding what is actually happening in your body is the first step to making an informed decision about whether and how you want to address it. Okay, so let's start at the beginning. What is actually happening? The root cause of vaginal dryness after menopause is a single word: estrogen. Estrogen is the hormone that, among many other functions, maintains the health of the vaginal tissue. It keeps the vaginal wall thick, elastic, and well lubricated. It supports the collagen and elastin that give the tissue its structure. It stimulates the mucous gland in the vaginal walls to produce natural lubrication, and it maintains the slightly acidic pH of the vaginal environment that protects against infection. When estrogen levels decline during perimenopause and then drop significantly after menopause, all of these functions are affected. The vaginal walls begin to thin. The medical term for it is vaginal atrophy, though I prefer the term genital-urinary syndrome of the menopause, or GSM, because it is more accurately captures the full range of changes that occur and why they matter beyond just dryness. The tissue loses collagen and elastin, which means it becomes less elastic and less resilient. The mucous gland produces less lubrication. The pH of the vaginal environment shifts, making it more vulnerable to irritations and infection. And these changes don't happen overnight and they don't stabilize once they start. Without estrogen or a clinical intervention that addresses the underlying tissue health, they are progressive. The tissue continues to thin and change over time. This is why vaginal dryness after menopause tend to get worse rather than better if left unaddressed. The biology is working against you, and a lubricant or moisturizer applied to the surface doesn't change that biology. Let me be specific about what these changes feel and look like in daily life, because I find that naming the experience specifically helps women recognize what they've been going through and feel less alone in it. Dryness and irritation. A persistent feeling of dryness, itching, or burning in the vaginal area that doesn't go away on its own and isn't related to any infections. Discomfort or pain during intimacy. This is one of the most significant impacts of vaginal dryness for many women. When the tissue is thin and dry, friction during sexual activity becomes uncomfortable and painful. Some women describe it as a burning sensation. Some describe it as a feeling of tearing and rawness. Many women quietly stop engaging in sexual activity because of it without ever telling their partner the real reason. Reduced sensation. As tissue thins and loses elasticity, sensitivity can also change. Some women notice reduced arousal or reduced sensation during intimacy that they attributed to hormonal mood changes, but it's actually partly a tissue response. Recurrent vaginal infections. The shift in vaginal pH that comes with estrogen decline makes the vaginal environment less able to protect itself from bacterial and yeast infections. Women who were never prone to this before may find themselves dealing with them repeatedly. Urinary symptoms. This surprises many women. The urethra and bladder are also estrogen-sensitive tissue. As estrogen declines, the urethral tissue thins alongside the vaginal tissue. These contribute to urinary urgency, frequency, and sometimes stress urinary incontinence. The leaking that happens when you sneeze, cough, jump, or even laugh. Any combinations of these, and often all of them together, quietly, without a name and without a conversation. I want to spend a moment on something that doesn't get discussed enough in clinical conversation about vaginal dryness, and that's the emotional and relational impact. Intimate discomfort after menopause affects relationship, not because women stop caring about their partner or their intimate life, but because pain and discomfort during intimacy naturally leads to avoidance. And avoidance, when the reason isn't communicated, can create a distance in relationship that has nothing to do with love or affection. Many women feel embarrassed to tell their partners that sex is uncomfortable now. Some feel like their body has let them down. Some grieve the intimate connection they have had before menopause and feel like that version of themselves is gone permanently. It affects confidence in other ways too. Women who experience vaginal dryness, itching, and recurrent infection describe feeling self-conscious in ways that go beyond physical, feeling less like themselves, less at ease in their own body. These are not small things. They are part of how women experience their life every day, and they are not inevitable. They are not something that every woman must simply accept as the price of getting older. They are a clinical reality that has clinical solution. Knowing that and feeling entitled to explore those solutions is something every woman in this situation deserves. Your comfort in your own body matters. Your intimate life matters. Your confidence matters. All of it matters. Before I talk about what actually works, I want to address what most women try first, because understanding why these approaches fall short helps explain why clinical treatment makes sense. Lubricant. Water-based and silicone-based lubricants are widely used, and they do provide temporary relief during intimacy, but they address friction in the moment. They do not address the thinning of the vaginal tissue, the loss of collagen, and the shift in the pH or the reduction in natural lubrication. The moment the lubricant wears off, nothing has changed. Vaginal moisturizer. These are slightly different from lubricants in that they are designed for regular use rather than just during intimacy. They help with the ongoing dryness and can improve comfort day to day. But again, they are managing the surface symptom. The underlying tissue changes continues to progress. Topical estrogen cream. Prescribed topical estrogen is one step closer to addressing the root cause because it delivers estrogen directly to the vaginal tissue. For many women, it provides meaningful improvement in dryness and tissue health. However, not every woman can use estrogen, including women with history of hormone-sensitive cancers or certain cardiovascular conditions, and some women simply prefer not to use hormone-based treatments. Oral hormone replacement therapy. Systemic HRT addresses the hormonal change body-wide and can significantly improve vaginal symptoms as part of that. It carries its own consideration and is not appropriate for every woman. All of these approaches have their place, but none of them directly address the collagen loss and structural tissue change in the vaginal walls in a non-hormonal, non-systemic way. That gap is exactly what clinical treatments like Thuzzle and laser vaginal rejuvenation address. Let me walk through the clinical options that address the underlying tissue change, not just the surface symptom. The first is laser vaginal rejuvenation. A precisely calibrated laser is delivered to the vaginal tissue, creating controlled microstimulation that triggers the body collagen production response. Over the weeks and months following treatment, the vaginal walls thicken, the collagen and elastin content improve, natural lubrication increases, and the pH of the vaginal environment normalizes. Results are gradual and progressive. Most women notice meaningful improvement in dryness and comfort after 2 to 3 sessions. A standard course is typically 3 sessions spaced apart 4 weeks, following biannual maintenance. The procedure is non-surgical. There is no cutting, no stitching, and there is no downtime. Sessions typically take 20 to 30 minutes. You can go about your normal day immediately after. The second option is Thuzzle by GMV, which uses a radiofrequency energy rather than laser to achieve the same fundamental goal, stimulating collagen production in the vaginal tissue to improve thickness, elasticity, moisture, and overall tissue health. Thuzzle is particularly effective when urinary symptoms are also present alongside the vaginal dryness because the radiofrequency energy addresses the pelvic floor tissue at the same time as the vaginal walls. Women dealing with both dryness and stress urinary incontinence often find that Thuzzle addresses both the same course of treatment. The third option, for women who can use it and who want to address the hormonal root cause directly, is topical estrogen or systemic hormone replacement therapy, ideally in combination with one of the tissue-stimulating treatment above for the most comprehensive approach. The right combination depends entirely on your individual situation, your medical history, your specific symptoms, and what your priorities are. This is what a consultation is for. What I want you to take away from this section is that there are multiple clinical pathways. None of them involve surgery. All of them are available at Premier for her. And all of them start with a private, honest conversation about what you are actually experiencing. Let me be specific about who this treatment are most appropriate for. Okay? Women who are in perimenopause or have completed menopause and are experiencing vaginal dryness, discomfort during intimacy, reduced sensation, recurrent infection, or urinary symptom. Women who cannot use or prefer not to use hormone-based treatment and are looking for a non-hormonal clinical option. Women who are using topical estrogen but finding it isn't fully addressing their symptom and want to add a tissue-stimulating treatment to their approach. Women who want to be proactive about maintaining vaginal tissue health rather than waiting for the symptoms to become more significant. These treatments are not appropriate during pregnancy, with active vaginal infections, or with certain medical devices or conditions. All of this is assessed properly during the consultation before any treatment is recommended. In terms of what to expect from results, both laser vaginal rejuvenation and Thuzzle produce a gradual progressive improvement rather than an immediate dramatic change. Most women notice meaningful improvement in dryness and comfort within 4 to 8 weeks of beginning treatments. The most significant result develop over 3 to 6 months as the new collagen matures. Maintenance sessions every 6 to 12 months help sustain those results long term. And for many women, the combination of improved tissue health and the confidence that comes with it produce changes that go far beyond the physical. I want to close with something about where you would have these conversations and treatment, because I know the barrier for many women isn't the treatment itself, it's not knowing whether the clinic will feel safe. Premier for Her exists specifically for this conversation. Every consultation happens privately, every treatment happens privately. Every doctor on the Premier for Her team has experience in women's intimate health and approaches every conversation with genuine care and complete professionalism. There is no question too embarrassing. There is no concern too small. There is no version of what you are experiencing that we haven't heard before and won't treat with the same respect and attention as many other medical concerns. If you've been carrying this quietly for months or years, you don't have to anymore. A consultation is the beginning of conversation, not a commitment to anything. Come in, tell us what you've been experiencing, and let us give you an honest answer about what your options actually are. We are here whenever you are ready. If this video answered something you've been quietly wondering about, the next step is a private consultation where we can look at a specific situation and give you an honest, personalized answer. You can WhatsApp us anytime between 8 a.m. to 10 p.m. every single day. The link is in the description, and if this was the conversation you needed, follow us. There's a lot more honest women health contents coming to you.